administrators, we are all certified in CPR. Today I will be covering adult CPR. It's always good to refresh your knowledge and your skills in CPR, so I will be covering adult CPR. The first thing that you want to do is recognize that there is an emergency. So if you find this individual lying on the ground, you're not sure if they're breathing, if they're not breathing, you want to find any personal protective equipment that you have. So that could be gloves, a breathing barrier. If you're at a practice or at a competition, the athletic trainer will have this, or maybe you as the coach bring this to the competition or the practices. But you always want to make sure that you use your personal protective equipment to protect you from any infectious diseases that the victim may have. So go ahead and put on your gloves.
It's always best practice to use latex-free gloves.
You can also have your CPR breathing barrier ready if there is somebody else there to help you. That's a second responder. They can do this for you as well. So once you recognize that there is an emergency, you want to go ahead and get down to the victim's level. You want to check to see if they're breathing or not. So you want to get down to their level, see if their chest is rising or not. You want to feel, see if you can feel any air on your cheek or listen for any breathing. You're going to do this for no more than 10 seconds. As a reminder, agonal gasping is not normal breathing. So you want to make sure that you really spend those 10 seconds and get a good idea whether or not they are breathing. Once you find out that they are not breathing, their chest isn't rising, you want to go ahead and call 911. So you can use your cell phone if you have it on you, or you can send somebody to call 911. So this victim is not breathing. You want to go ahead and begin chest compressions. So when you interlace your hands, it's very important to not have your fingernails underneath of your hand. If so, you're going to dig your nails into the victim's chest. So it's really important to have your fingers up off of the victim's chest. Your hand placement is going to be in the middle of the victim's chest, just between the nipple line. You want your arms straight and you want to be up and over your victim. So my hands are off my victim's chest. You can either do one hand over the top of the other, whatever is comfortable to you. You should be compressing 2 inches or greater on an adult. So you're going to begin 30 compressions. All right, that was 30 compressions, a fairly moderate rate. You want your chest compressions to be effective. So after each compression, you want to allow the chest to fully rise and recoil before compressing again. So once you complete your 30 compressions, you're going to give 2 breaths. So if you have your breathing barrier ready, you may or may not have a breathing barrier. You want to open the airway. This is really important that you open the airway so the air that you are exhaling into the victim goes into the victim's mouth and not out the breathing barrier. So you want to make sure that you have the mask sealed while opening the victim's airway. So you're going to give 2 breaths. Each breath is lasting about 1 second. If the victim is larger than you, you're going to want to exhale all of your air that you can. If the victim is smaller than you, you're going to want to use about half of your breath or 3/4 of your breath. So once you give your 2 breaths, you would go right back in to 30 compressions. You're going to continue this combination of 30 chest compressions to 2 breaths until the victim becomes conscious, until EMS arrives, or until an AED is ready to use. So that was the refresher today for adult CPR. The next refresher will be covering AED.